Hello, I'm Dr. Craig Stern of Pharma Pharmaceutical Consultants. Today I want to talk about cost per patient per month, also a fundamental insurance, clinical, healthcare kind of indicator, and the importance of it is something that we want to address and why. Now, in a prior conversation we talked about per member per month costs, where we effectively indexed all of our costs to and divided by all the beneficiaries so that we had a way of comparing one group to another. Similarly, we can do that with patients. Now, what do I mean? Let's suppose that you have a commercial population and you have 1,000 patients in it. Commonly, a third of those people in that commercial population will actually utilize the benefit at any given time. So for example, if we had 1,000 people, we could expect in general that a third of them would be getting prescriptions for drugs. Many of them would get some physician visits, hospital visits, ER visits. Clearly, they wouldn't use the same number of hospital or emergency room or other kind of visits as they would drugs. But I want to focus on drugs for the moment because that's really where we have an opportunity to try and understand this really easily. And that is on a per member per month basis, we're taking the entire cost of the program and dividing by the total number of beneficiaries. It's kind of like a big bathtub. There's people filling the bathtub. All of them are beneficiaries. And in that case, only some of them actually utilize it. Only some of them go to a doctor. Some of them go to a hospital. Some of them get drugs. So the question that we have to address here is this. We have one number, our PMPM, the fundamental per member per month number index to use for comparison and cost. But we also want to know, what does it cost for every individual that steps up to a prescription counter and gets a prescription? What is the cost of every individual that steps up to get emergency room, hospital, physician office visits, etc.? This is known as per utilizer because these people are known as utilizers. Some people call them as patients. Either way, as a utilizer or a patient, we have a cost per patient per month or per utilizer per month. The importance of that is that it tells us how much is actually being used in cost and resources and in usage by those people who really do utilize the benefit, who are picking up those prescriptions, going to the hospital, going to the doctor's office, etc. Now, why does it matter? It matters because those individuals are not just paying in, they're actually utilizing. This gives us an opportunity to identify what are the diseases we're treating, what are the conditions we're treating, how severe are the people, what's going on with their care. Is it repeating? Is it something that they address just every once in a while? Or for example, do they pick up prescriptions every month? Do they get it whenever they need it, etc.? So our costs per patient, per utilizer, our PPPM, some people use it as PUPM for per utilizer per month, or PPPM for per patient per month. At the end of the day, we're talking about how do we go about looking at a population in order to deal with those people who actually utilize. What do we have to know about them so that we can do a better job of treating them, making sure that they get all the services they need, and especially prevention. Thank you for taking time to spend with me today. I wish you good health. Be well.